few sessions, but I am now joined here by, of course, Professor Praphan Phanuphak, the Director of the Thai Red Cross AIDS Research Center. Sawadee to you. Now, we both have a very important role to play.
Okay, so hello, friends and colleagues who are watching the Bangkok Symposium in your office or at home. I'm sure that for the last three speakers that you have heard, it's an excellent program. Okay, so I'm sorry that you cannot be with us this year. I hope that you will be with us next year.
Correct.
Now we should have our first speaker to be interviewed.
Yes, we are going to be focusing on same-day ART, caution to the wind, and our guest speaker is none other than Dr. Diane Havlir. She's the chief of the HIV and AIDS division at San Francisco General Hospital. Let's welcome her. Sawadee ka.
Thank you.
Please take a seat here, Dr. Diane. Now, you're also a professor of medicine at the University of California. That is right?
Yes, in San Francisco. Yes.
So, yes, please give us a general overview of this important topic, same-day ART.
Thanks. So many of you who are clinicians know for many, many years, there was a delay between when a person was diagnosed with HIV and when we started antiretroviral therapy. And in some regard, this makes sense. Antiretroviral treatment we give for patients for life until we can cure the disease.
Right.
If you're 20 years old, you're going to be taking it for the next 60 years. So we wanted to make sure that patients were actually ready to start the therapy and they would be able to comply with the therapy. And the reason why it's important to comply is because if one doesn't take the pills that they're supposed to, the virus is really smart and it can become resistant, then the medicines no longer work.
Oh, all right.
You see, so we want to make sure when people start, they're ready to take their medicines as we prescribe. So it was believed that if we did a lot of counseling before patients started therapy, they would be more likely to take their therapy for life. We also did not know until recently that even when patients are feeling fine, the virus is doing damage to their body.
So they're acting up inside, you feel all right, but you don't know what's happening inside within your body.
Exactly.
So it's very important that you continue medication.
Yes, and that you start as soon as you can, because every day one delays, the virus is doing damage to the body. So there are really three reasons now why we think that same-day ART is important. The first is that it is beneficial for the individual and you immediately cut off the damage that's done to the individual. Secondly, one of the reasons we can't cure HIV is because there's a reservoir of HIV that gets established very early. If a patient starts therapy very early, we can reduce that size of the reservoir.
Right.
So maybe in the future, we'll be able to cure HIV easier in those patients. Finally, we also know that the level of the virus predicts transmission. And so the sooner we get viral suppression in a person who's living with HIV, not only does it benefit their health, but it also benefits and reduces their ability to infect someone else.
Right.
So Diane, what do you think, what are the main barriers that, if this same-day ART will be implemented in Bangkok or in Los Angeles, for example? What are the main obstacles?
There's
some challenges.
Yes, there are some main challenges. First of all, I think one of the challenges is that we have been given patients the message that, oh, you can start ART when you're ready. And so that is one, is that the education and the messaging about the importance of starting ART. Number two is that the providers themselves, the clinician, have to believe that there is some benefit to starting ART. So that's also an educational. The third, I would say, is logistics. There are many, many more testing sites than there are places to start antiretroviral therapy. So we have to figure out how can a person get from the testing site to the clinic so they can start.
Yeah, so with that regard, do you think that well-trained nurses or well-trained community healthcare workers can also be the providers of ART for the same day result?
I think
that should be the way.
Yes, I think that's a great idea, and I think that a physician on that day, the tasks that they could do, it could be reviewed, and a nurse or a provider also could start ART as long as there was adequate follow-up. But with all the people on the planet that we still have to treat for ART, that probably is the way forward.
Okay, so thank you very much, Diane, because there are a few other speakers that will come
Yes.
up to give
Right,
talk.
thank you.
Thank
Thank you
you.
very much. Khop Kun Ka. We were just speaking to Dr. Diane Havlir, Chief of the HIV and AIDS Division at San Francisco General Hospital. She's also a Professor of Medicine at the University of California. Thank you very much as well, Professor Praphan Phanuphak, Director of the Thai Red Cross AIDS Research Center, for helping me there co-host that first session on same-day ART. Caution to the wind. We move on now. Sawadee ka. Joined by my next co-host, we are sitting here, or I'm sitting here next to Professor Kiat, Ruxrungtham, Vice President for Research and Innovation of Chulalongkorn University. That is right.
Yes.
And
my
you are
pleasure.
going to be helping me conduct the next topic. We're going to be talking about preventative vaccines for HIV. Shall we bring on our next
Yes,
guest?
please.
Our next guest is Dr. Merlin Robb. He is a Deputy Director at the U.S. Military HIV Research Program. Let's welcome him onto our show. Dr. Merlin Robb, Sawadee ka. Welcome to Bangkok. Thank you very much
Sawadee ka.
for flying all the way to be here and for
My pleasure.
sparing a bit of your time from the busy schedule at our symposium to tell us more about preventative vaccines for HIV. First of all, a general overview to our viewers joining us live.
Sure. Well, I think that we're entering an era of some cautious optimism. We have a follow-on study now to the successful trial conducted in Chonburi and Rayong, for which the Thai people should be very proud, and it was a very major contribution to the field. And so now at last, perhaps way too many years after that success, we have a follow-up study in Southern Africa. And hopefully another study to start in about a year, and additional studies after. The more concepts we test, the better our chances of learning what it takes to make an effective vaccine and to create a program that will have a decisive effect on the transmission rate globally.
Right. But it is an optimistic view that we have here. Things are looking bright.
I think it's looking better, yes. Certainly better than it was in 2007.
So, Marin, could you tell us about what we have really learned from the Thai trial, the large Thai trial?
Sure.
Yes.
I'd be glad to. And looking back to 2007, some of you will recall that a study had been stopped early, the Merck study, the STEP trial, not only because it didn't work, but in fact, the individuals receiving that vaccine had a higher risk of acquiring HIV. This was a stunning, dismaying, and very depressing finding. We did not think we would do harm with our vaccines. We, of course, knew that we may not help, but not to do harm. And so the Thai trial was ongoing at the time. People were skeptical that we'd see a positive result. So in 2009, in Paris, when the result was announced, it was a transformative experience for the entire HIV vaccine and prevention field. Not only had we conducted a trial safely, more importantly, we'd seen a positive signal to prevent HIV infection, not just to control the disease amongst those who got infected. And so it's created a wave of optimism that now has finally translated into some new studies starting this last year.
So, what the current strategy that you and then many other moving toward, to further improve the vaccine efficacy?
So first, we're going to vigorously pursue the clues that arose out of the Thai vaccine efficacy trial. But second, we're going to, I hope, be much more aggressive about getting new concepts that potentially depend on different immune responses to see how they complement or extend the findings from RV144. I'm referring now to the Janssen program, which is very advanced, and new vaccines that I mentioned in my talk that are coming forward. And then finally, although I think it's going to be a difficult goal to achieve, we now have some prospects of what it takes to develop a broadly neutralizing antibody, and we're able to develop the kinds of experiments that might incrementally lead us to vaccine platforms that achieve that objective.
Difficult, but I believe not impossible.
Correct. Yes.
Next question.
So, the last question is what is your prediction for the next 5 years or 10 years or so?
Well, I think the horizon is in the 5 to 10 year range, because it takes years to get an efficacy trial started, and several years, 6 years in the case of RV144 here in Thailand, before you get your result. So the trials that are starting now, we would hope to see results in 2020, 21, 22, on the early end in 2004 and 5 later. So we are in the 5 to 10 year range. But then keep in mind, the payoff for an effective vaccine is something that doesn't require a patient to take something every day or to have an interaction with a healthcare provider, say every other month, but rather 6 or 7 visits and perhaps 2 or 3 years of protection. So there's a great deal of payoff if we're successful.
Now, let's go back to the basics here. What are some of the preventative vaccines available, or what are the basics to prevent at the moment out there?
Well, we have nothing that's proven to work. And one of our concerns is the one study that we've done in Thailand that had a positive signal was in Rayong and Chonburi provinces, but not in high-risk zones in those communities. And so it's kind of a community risk in an area that doesn't have a very high prevalence of HIV compared to, say, Africa. So perhaps it's a vaccine that's potent enough to protect intermediate levels or lower levels of protection, but on the global arena, where transmission rates, our transmission rate was way less than 1% in RV144, but in Africa, the transmission rate's 6, 7, or 8%. Maybe a much stronger vaccine is needed, but I do believe that we are seeing those on the horizon, and we're optimizing what we did in RV144 to improve its potency and breadth.
How much longer do you think it will take until we come up with something?
Well, I don't think we'll have answers for 5, 7, 8 years.
All right.
So this is not a game for impatient people.
No.
We drive on in the background, plodding along, trying to make an HIV vaccine, and applaud our colleagues who are
their hard
treating
work,
everybody,
yes.
instituting PrEP, prevention of mother-to-child transmission. I don't think that the problem will be solved in 5 to 10 years, so there'll still be a place for vaccines at the end of the day.
But things are looking good, as Dr. Diane mentioned,
Yes.
in terms of the antiretroviral therapy.
Yes.
So it's very important regarding that aspect.
Absolutely.
All right.
That's a key, and it will have a big impact, fortunately,
Right.
on reducing new infections globally. Yes.
Do you have any further questions for?
I think I got all the wonderful answers.
And it was very clear as well. We thank you so very much
Thank
for your
you.
time.
Thank you for your time.
Dr. Merlin, Robb, thank you
Thank you.
very much.
Thank you
the
very much.
Deputy
Thank you.
Director
Yeah. Thank
at
you.
the
Thank
US
you.
Military HIV Research Program. Thank you very much to you as well. Of course, we had Professor Kiat Ruxrungtham, the Vice President for Research and Innovation of Chulalongkorn University, joining me there. Now it's quick in and quick out, as you hear, because as you see, because we have so many important issues to discuss for our real-time live streaming as part of this 19th Bangkok International Symposium on HIV medicine. And the next gentleman has arrived already. I'm sitting here right next to Dr. Torsak Bunupuradah. Now, you're from HIV-NAT, right, and you're also a professor, but you specialize in pediatrics.
Yes.
That's correct, and you're with the Thai Red Cross AIDS Research Center as a researcher as
correct.
well. Now, Dr. Merlin, Robb also mentioned a little bit vertical transmission. For this first segment of our interview, we're going to wrap up with this vertical transmission, and we're going to bring on our special guest, Dr. Thanyawee Puthanakit. She's also a professor at Chulalongkorn University. Sawadee ka, and welcome to our live streaming session. You're also a medical doctor working for the Thai Red Cross AIDS Research Center as well.
Yes, I'm working at Thai Red Cross AIDS Research Center and also at the Department of Pediatrics, Faculty of Medicine, Chulalongkorn University.
Right. Now, it's always good to be last, because then we see how much time we have, and lucky for us, we've got more time, so we can extend our interview session a little bit. Now, I'm a mother myself, and it pains me, it hurts me to realize that AIDS, you know, if a mother wants a child and she has AIDS or she's HIV positive, she can very likely pass on the virus to her child. But we've got absolutely fantastic news that according to research here in Thailand, that can be reduced, and it's reduced significantly. And you're going to share with us the statistics, aren't you?
Yes, so if pregnant women have baby 20 years ago, the risk of baby to be infected is 1 out of 3.
Wow.
It's very sad. But now, in Thailand, in general, if the mother received appropriate treatment during pregnancy and also baby received appropriate treatment, and had very good, perfect result. The transmission rate is below 0.5%, 5 out of 100.
That just gives me goosebumps. I mean, that is
Yes.
fantastic
Yeah.
news. But you were saying, please continue.
Yeah, but for the whole country, the overall program in Thailand, we just received the WHO validation that overall in country, less than 2% transmission, meaning that if you have 100 pregnant women, only 2 babies will be infected with HIV. And we hope that we can be reduced further down.
That's great. That's fantastic news indeed. Now, what is it that has to be done for a mother realizing that, oh, she's
Yeah.
pregnant? What's the process like to reduce the passing on of the virus to the baby?
The most important thing is to, if you're pregnant, you need to go to antenatal care because if you will do HIV testing. So even though it's HIV positive, if you have proper treatment, you will be able to protect baby. So the first key message is that get HIV testing when you are pregnant woman. And secondly, if you are positive, you can ask for antiretroviral drugs for mother and also for baby.
For the baby as well. All right. So this is taken while the mother is carrying the child.
Yes.
Okay. All right.
Okay, I have a question.
Yeah.
For this successful story, what is the most challenging of the PMTCT in Thailand and for the validation also?
Yeah. For Thailand, it's just not the successful program just yesterday, but we have implemented this for 2 decades. From the Minister of Health, from the researchers, from the community, we try to encourage people to know and to prevent HIV transmission. And every single hospital in Thailand can provide a service.
Wow.
So we have to make sure that every hospital can do this because it's a challenge in some countries in Asia that this prevention is just available in big cities, but not everywhere. So we
Right.
have to make sure that this life-saving to prevent a life of baby can be accessible everywhere in Asia.
So we do really want to get, first of all, the great news that it can be prevented to a certain extent, to a big extent that is, and that it has to get out to the far-reaching
Yes.
or remote areas as well. I mean, we're talking about countries such as archipelagos, the Philippines, and then
yeah.
also Indonesia, 16,000 islands, I think, very, very remote
Yes.
areas. We need to get out there, get the word out, and get the medication out there as
Yes.
well.
I have more questions. For example, if I'm a doctor in a rural area, in a rural hospital, without like less infrastructure compared to Bangkok, how can we help the patients?
Yes. So I think HIV testing, they are everywhere. It's not just for the baby or pregnant woman, it's for every person. So HIV testing can be accessible everywhere. So whenever you have HIV positive, and then you have to request for medicine. So for example, in Thailand, if you are in rural area or because of the insurance or migrants, you can request drug from Thai Red Cross program to get appropriate drugs. And if you are in a more sophisticated place, you can do viral load monitoring to make sure that HIV virus in mother need to be very low at the time of delivery. Because you can imagine that during delivery process, the baby was exposed to blood and some fluid from mother, and virus is there. So have to make sure that the viral load is undetectable at the time of delivery to prevent baby. So I think now we have all equipment. We have line, we have telephone, we have everything that we can ask for connection to get support.
Yeah, I have one issue now because your program also have the special drugs. It's called Ruxrungtham to rapidly decrease the viral load. So if I'm a doctor from other provinces, how can I access to this care?
Yeah. To further elaborate is that the standard drugs for pregnant women can access in every hospital in Thailand, but there are special drugs that have a quality that can reduce the virus within 1 month. And this is perfect for mother who just learned that she has HIV in late pregnancy. And this drug will hopefully be available in the national program. But meanwhile, you can contact Thai Red Cross AIDS Research Center and then get these drugs to prevent mother who have very high risk of transmit the virus to baby. You can contact us and get the medicine. It's a program under patronage of Her Royal Princess Somsavali.
Right, she works very closely, and I know that there's a lot of events out there marathons or social events, trying to raise money so that the money can be donated for R&D, because I know that research and development is so very important when it comes to matters like this. Any challenges out there which you could talk about, perhaps, that needs to be overcome to make things even better? And in terms, yes, you did mention that getting out to the outreach areas. Any other forms of obstacles out there?
I think the most important thing is for everyone in community to know that pregnant women can have HIV negative baby. Because for layperson, they just feel that if mother is positive, the baby definitely need to be positive, which is untrue. It's not true nowadays. So they need to know that it can be prevented. And secondly, accept that the woman is not intention to be infected, and not put burden or stigma on her, which make her more problems and not open up and cannot ask or request for help. So everyone can help for vertical transmission, but accept the HIV positive person and also to help her to get access to treatment.
Now, I'm not a doctor myself, but I think this issue is extremely important. The stigmatization on one who is HIV positive. They don't even understand sometimes the difference between HIV positive and AIDS. You don't have AIDS, but you have the virus, but then there are now ways to not pass that on, and you don't even get AIDS or HIV positive from saliva. Many people do not even understand this, and then the individual who is HIV positive is stigmatized. And you're a pediatrician. Now, sometimes it's easier for adults to really understand the issue, but when you are a child with HIV or HIV positive, that's a bit more of a challenge, isn't it? How do we help a child to sort of be inserted into society and live a normal life among his or her peers?
We have social workers who can support the families, and we have the process we call disclosure. But this one is like process, and doctor and the social worker help the family to tell about the diagnosis for the children. At average, maybe 10 years or 12 years old, and they learn.
That's wonderful to hear, but I think we do need to continue to educate people out there to properly understand how everything works, and more importantly, as we're hearing such wonderful news from the doctors who are sitting in the spotlight here, such excellent news. For example, this vertical transmission, it's now being reduced to 2%. And perhaps 0 in the near future.
I think our team have the plan, right? You aim for 1%, right?
Yeah, and for the colleagues in Thailand, we will have an educational session in March that you can participate and learn more about technical things and how to work in your community or in your hospitals to reduce down the transmission rate from 2% currently in Thailand to below 1%.
Excellent.
And you are very invited, and it's free registration for this academic event in March 2017.
There you go. We thank you so very much, Dr. Thanyawee Puthanakit, for bringing us such wonderful news. And there's another excellent event that you can head over to, and it's free of charge as well. Thank you so very much. Thank you. And we thank you as well, Dr. Torsak, for joining us for this last segment of the first interview session as part of the 19th Bangkok International Symposium on HIV medicine. Now, we will be having these live real-time sessions throughout the rest of today. The next one, join us at 12 at noon, that's Thai time. We will be talking about testing and treating. We'll also be looking into how to implement PrEP successfully. That's an interesting topic. And what do gay men need for effective HIV prevention? So a lot more to come, and do join us. Once again, it is at 12. But for now, we are going to head back into the conference rooms and learn more from the guest speakers. See you later. Sawadee ka.